This video is going to explain CHROME Lite. CHROME Lite is chrome, except that it's not metal, it is plastic. So the two main components that are normally made out of metal, we make them out of plastic. For the most part, this is for expediency. In case we have to, if for some reason we have to make the case quickly, we can print resin a lot quicker than metal and assemble these cases. This can also be used as a way to just understand the CombiGuide Lite, which is fixation base, osteotomy guide, carrier guide, and then maybe a conversion denture. So those three components here are CombiGuide Lite, and this ensemble is CHROME Lite. All right, let's go through the components, all the componentry. So this is an edentulous case. All right, so we have the dual scan denture prosthesis here. I'm just going to remove this. This is a maxillary pin guide, and we do want to fill these in as often as possible so that we have a nice palatal seat, but the denture was a horseshoe, so we're limited to that. Okay, that's the reason that is designed like that. This is the bone model that has the holes already not drilled but placed digitally. This is the bone reduction model. As you can see here, we now add a line across the top here that shows the bone reduction volume right there. Okay, and this model is the one we'll use during mounting and during surgery here at the laboratory for checking. This is the take-home prosthesis. Pink on lingual, pink on facial. Beautiful. This is the rapid appliance take home, which is on the lingual, it is white or natural color, and then pink on the labial. Pin guide, carrier guide, fixation base, osteotomy guide, backup bite, pins and drills, and then gaskets. Now, those are the components and the pieces. Let's just go through quickly how this is assembled, because it's a little bit different. Because it's plastic, we do not put chrome locks as the assembly to stack the components. Instead, we use pins. And these pins, just for your knowledge, are just short fixation pins. They've just been cut down. So what the process is, so let's go through it as if we're doing a surgery. So the fixation base and the pin guide are assembled, and as you can see here, there is a chrome loop. I'll call it chrome even though it's not it's plastic. There's a chrome loop, there's a chrome box, the three of them assemble together. The pin will then push through here facially. Let me put one in here, there we go. And it will lock them together like so, just like that, and then you'll hold it in place and deliver just like a regular pin guide. Okay, and you can tie some dental floss to these. These are a little bit loose in here. I'm going to address that. Put a little bit of resin in there and tighten them up. Okay, so then once the pin guide is seated, then you would just remove these little set pieces there, take the pin guide off, level the bone down, you'll be pinned. All right, there'll be a normal pinning process when the pin guide was seated. Just for the sake of going through this the right way, let's put the pins in. Okay, level the bone down as normal. Then the osteotomy guide goes in, or of course you can place the carrier guide into to make sure that there is enough reduction of bone and tissue is out of the way. So then the osteotomy guide goes in, and then secure it again with these pins, and then go through the process. Right. So then you have the carrier guide seated, pinned, prosthesis, rapid appliance, pickup, gaskets. Everything else is pretty much the same process as chrome. It's just plastic. So that is CHROME Lite.